Hi there, welcome in. I'm Dr. Honey. It's nice to meet you. I'll be doing your ear exam today. It looks like you might have some ear pain going on. Okay. Just the one ear? Okay. We'll go ahead and look at both of them just in case, okay? All right. And what are your symptoms? Do you have ringing, a feeling of fullness, soreness? Okay. And about how long has this been going on for you? Okay. Well, we're going to get this figured out for you today. And have you had an ear exam in the past? Not just for ears? Okay. All right. Well, I'll be sure to walk you through every single step, okay? We're going to go through several tests just to check your hearing, make sure that that's not affected. A loss of hearing might indicate something a little bit more serious, so we want to check that off the list right away. And then after that, we'll just move into an easy ear cleaning. And if that doesn't seem to relieve your symptoms, we'll just go ahead and try a few more treatments for you today, okay? All right. No matter what, we'll be sure to give you a little bit of relief. Okay. And just tell me if you experience any discomfort. I'm always here to adjust what I'm doing. So the first thing that we're going to do is just a simple hearing test, okay? I'm going to place these earphones over your ears, which are controlled by this sound box here, okay? I'm going to play a few sounds for you. You should hear one in one ear, one in the other. Just raise your hand as you hear the sound on each side, okay? All right, let's begin. I'm just going to place these over your ears. Okay, do those feel snug? All right, I'm going to turn them on now. All righty. And just turning on my sound system. Okay. Beep. Beep. Okay. Beep. Good. Beep. All right, excellent. Beep. Beep. Good. Beep. Great job. Beep. All right. Beep. Okay. Excellent job. I'll just go ahead and remove those now. All right, there we go. Looks like your hearing is very good. Just in case though, I'm going to use this tuning fork. This is going to make sure that you can hear different frequencies and different tones, all right? So just listen and raise your hand when you hear the noise stop, okay? Good. One more time. Okay, good job. All right, so it seems like your hearing luckily is doing just fine, but let's go ahead and get to the bottom of that pain for you. I'm just going to start by putting on my gloves here. And I'll start the exam with just some physical touch just to make sure there's no swelling in any of your nodes. You want to make sure that you don't have any cysts or any swollen glands, okay? Okay. So just sit still, relax your shoulders. I'm going to gently feel up and down your neck, okay? All right. Okay. Feeling on this side and on this side. Okay. And I'm going to touch just underneath your jaw here. Okay. Looks like we've got good circulation in there. I don't see any lumps or bumps that I'm concerned about. Okay, good. That rules out a lot of things. So firstly, we're just going to do an ear cleaning for you. This is going to start by cleaning the outside of the ear, just very gently with a mild surfactant and a gentle sponge, okay? Then after that, I'll go ahead and pat you dry. We can then move towards cleaning the inner ear a little bit more effectively. I'll go ahead and start with this ear that you said is not hurting you, okay? So I'm just going to get my water ready here. Just pouring it in to my bowl. Okay. And wetting my sponge. I'm just going to use this gentle cleaner here. And you might hear a little bit of fizzing. I'll just get that soap off of my sponge for you. Okay, now I'm going to gently wipe away some of that soap for you. Good. And then with a gentle cotton pad, just going to finish getting that all off you. Okay. Nice and dry there. How did that feel? Okay, no pain at all in that ear. Alright, I'm going to go ahead and move on to your ear. Be a little bit more gentle. Just adding a little bit of soap here. And then I'm just going to do that ear you said was causing you a little bit of pain, okay? So I'm just going to gently scrub. I'm being very careful on this ear for you. Okay. And rinsing off my sponge just like before. Alright. Now I'm just going to wipe that away. Okay. Good. And then lastly, I'll just use a nice cotton swab to dry that area off, okay? Okay. Okay, good job. So we've got that external layer clean. So now what we're going to do is we're just going to work on cleaning the inside of your ear. So to do that, I have this special tool here. This is going to get inserted inside of your ear, okay? And as the water gets pumped into your ear, I'm going to place your ear under this cup so that it catches any of the water that falls out, okay? Alright, let's go ahead and try it. So all I'm going to do is just position this right into your ear here. Good. And then I'm going to start pumping. Okay, here comes the water. It'll feel a little bit cold. Good Good job. Just stay nice and still for me. Okay. Good job. I'm just going to go ahead and empty out this dirty water. Good. And now we'll move on to the other ear. So same thing. Just going to place this into your ear. And then I'm going to hold this cup right under. Okay. And then I'll just spray. Okay, good. All right, wonderful job. Looks like we did get a little bit out of there. I'm just going to go ahead and use this cloth. I know it can feel a little bit wet in there, so I'm just going to dry that off. And on the other side. Okay, wonderful. And then I'll just go ahead and take a Q-tip. Remember, Q-tips should not go inside of your ear, but I am going to dry just the external part of the ear. So when we're looking at where to dry, we're just drying gently in these areas, okay? We're never wanting to stick the Q-tip inside of the ear. I know it can be super tempting, but all that does is compact more wax back into the ear canal, okay? All right. Just drying the outside. Feels nice still. Okay. And then I'll just have you sit still while I do this ear. Okay. Good. And how's the pain level of that? Okay. All right, we'll just go ahead and discard these two. So now I'm just going to get a really good look inside of your ear, okay? First, I'm going to start off with this tool. If you could just turn your head to the side, I'll take a good look inside. Okay, and a bright light here. Okay. Yeah. I do see some inflammation on this side. A little bit of redness. Do you happen to itch your ear very often? Okay, you have ever since it's been hurting. Okay, that explains it. Now just turn your head this way. I'm going to look inside this ear. Okay, bright light. Okay. Yeah, this ear does look really clean. Okay. All right. Well, just like we suspected, your one ear seems pretty good, but unfortunately that other ear, there's definitely something going on in there. So we have a couple different treatment options. We can first start with some of the less invasive things, and then if that doesn't seem to clear it up, we can of course move on to some more extreme treatments, okay? All right. So firstly, what I'd like to do is use this ear candle. I know it's a little bit unconventional, but I really think it could help lift out any of that stuck debris in there, okay? So what I'm going to have you do is just lay your head onto your shoulder gently. I'm going to stick this candle into your sore ear here, and I'm going to light the candle. As the candle burns, it's going to naturally suck up any of the gunk and goo that might be left over in your ear, okay? Alright, so just tilt your head. Just going to place this in, just like that. And now I'll light the candle. So it's very easy. Burns really quickly, okay? Alright. Just stay still, I'll hold it in place, and this guard will prevent any wax from dripping into your ear, so you don't need to worry at all, okay? Alright, so you can see already that it's working. Can you hear it too a little bit? Okay, good. Alright. So we're just gonna let that burn. Should be starting to feel a little bit of suction in there. A little bit of that moisture does really help create that really strong seal that we want. So as that seal works, you'll see that the smoke is going to start sucking anything out. Okay, good. And can you hear the crackling just a little bit? Okay, good. I'm just going to adjust this ever so slightly. Okay. Good, just holding that upright for you. Okay. And again, let me know if there's any discomfort at all. This shouldn't be a painful process. We don't want it to be damaging your ear any further, so I'm just gently holding it. Good. Okay, it's getting a little bit lower now. Good. Okay, getting nice and low now. Shouldn't be hurting at all. Let me know if it gets too hot. Okay, that's about as low as we want it to burn, so I'm going to go ahead and put it out now. Okay, good. How does that feel? Have you gotten any relief from that? Okay, maybe just a little bit. I'm going to go ahead and look deeply in your ear again. Just take a look with this magnifying glass, okay? Bright light. Okay. Yeah. Okay. Alright. Well, the redness does look a little bit better, but I'm still just a little bit concerned. So I'm going to take some of this cleanser. This is just to clean out any residue from the candle. So I'll just get this wet with the solution. And then I'm just going to gently wipe out the side of your ear. Okay. Good. Okay. So now we're just going to go in with a really, really gentle ear scraping, okay? I'm just going to use this very gentle little wooden pick here. I have a number of other tools, but I just like to start with the gentlest first. So if you could just turn your head, I'll just go ahead and scrape. Okay. Just making sure. I'm actually going to use my flashlight. That allows me to get just a little bit deeper into your ear safely. Okay. Just getting off any old skin, any flaky wax that might be left over. Okay. Just looking very closely as I go in a little deeper each time. Okay, good. I'm just going to dust off any of those flakes that might have fallen out. And Okay, good job. And I'm a little bit concerned that maybe the swelling is coming from inside of your mouth, okay? So I'm just going to check you over very quickly for some other illnesses that maybe explain some of the inflammation that I'm seeing, okay? So first things first, I'm just going to take your temperature, okay? I'm just going to brush back any hair here. Good. And then I'm going to roll. Okay. And your temperature appears to be quite normal, so I'm not worried about that. But just in case, I'm going to have you open up your mouth, stick out your tongue and say, ah. And I'm just going to have a look in the back of your throat. Sometimes with our ear, this part of the ear here actually connects down by our throat. So if there's something going on over here that's kind of inflamed, that can sometimes explain some inflammation that we might see inside of the ear, okay? So again, just say, ah, and a bright light here. Okay. Ah, very good. Okay. Yeah, I'm not seeing anything I'm too worried about. Okay. Okay. It doesn't look like it's anything that's coming from inside of your throat, which is actually a very good thing. But I'm just going to go ahead and just do a little light feathering of the inside of your ear, okay? This can feel really relaxing. It's going to help soothe down some of that inflammation. I am going to recommend when you get home that you just rest. You can put a little ice pack near your ear and just really try to take it easy to help your body heal and recover from whatever's going on, okay? All right, good. But for now, I'm just going to dust this feather. Good. Okay. How does that feel? A little bit ticklish? Okay, I can go a little gentler here. Okay. Good. Just getting right inside of your ear here. I know it feels a little bit strange. A little tickly. That's okay. Feels a little nice too. Okay, I'm glad. Okay. Good. Did you like how that felt? Okay, great. I do have a few more. This one's much more delicate, so I'm going to go just a little bit deeper into the ear. I can show you with that first one. I went about to here. Okay, so stay pretty far out, but with this more flexible one, it allows me to go just a little bit further into that ear canal of yours, okay? Okay, good. All right. So here we go. Just going a little bit deeper this time. Very gentle here. Your ear is a very delicate, fragile place. We never want to go too deep or be too rough. Okay. Good. Okay. Just gently sort of dusting that inside of your ear here. Feels really nice. Okay. That should be good. And now this one is just going to be for the outside of your ear, okay? Just kind of helps to get a little bit of blood flowing for you. It should feel very nice, but let me know if it tickles too much, okay? So just gently brushing along the outside of your ear here. Good. Gonna get just underneath your lobe. Okay. It should feel nice and relaxing, not too tickly. Okay. Good. Just getting the outside of your ear here. Okay. Wonderful job. So I am just going to make sure that we got anything that's stuck in there out, since that's the most common cause that we see for inflammation inside of the ear. I have a few different tools to use. I'm going to start with this honeycomb-like tool. It's just going to allow me to gently kind of pull this across the inside of your ear. It should be super, super gentle, but it will be a little bit exfoliating as well, okay? Alright, good. And again, just tell me if there's too much pain at all, and we're going to stop right away if that happens. Okay, good. Just keep your head turned here. I'm going to gently stick this in and just begin exfoliating your ears. Okay. Just getting the inner walls here. Good. Being really careful with small movements. Don't want to injure your eardrum at all. Okay. Alright, good. We don't want to do too much of that because that can actually be a little bit counterproductive and end up injuring the ear more than it helps it, okay? Alright. So the next thing that I can do for you is just a little bit of acupressure. As you can see, each part of the ear kind of correlates to a different part of your body. But since you're just needing some relief from your ear, this is just going to help stimulate some nice blood flow, okay? That will really help promote the healing process, okay? So just stay still. Just going to work my way down your neck here. Back up. Just making sure to hit any major pressure points along the way. Okay. Good, and I'm going to move up to your ear. Lobe area. Feels a little bit like a massage, doesn't it? Okay. And now I'm just going to hold the back of your ear just as I press against it. Okay, good. So we're making pretty good progress. Some of the areas that I covered was just outside here, down on your lobe, and then down onto your neck, okay? those areas are really going to help target kind of draining any lymphatic fluid that might be stuck in your ears, okay? How's the pain level doing? Has it changed at all since you arrived? Okay, it's gone down just a little bit. Okay, wonderful. I'm so glad to hear that. So I'm just going to place a few eardrops into your ear to send you home with. These are going to sit in your ear. They should naturally evaporate after a while. Please don't try to stick a Q-tip in there to try to get it out, okay? So I'm just going to just tilt your head to the side. It's going to feel a little cold, a little bit weird, but I promise I'll be quick. So we're just going to drop, drop, drop. Okay, just like that. Good job. And then I'm just going to suck out any excess here, okay? Alright, because we don't want a bunch of fluid sitting in there. That will attract bacteria for sure. So the medicine is already coating your ear, which is all we need. So I'm just going to suck out any extra. Okay. Looks like we just about got it all. Do you have any questions for me? Okay. Yeah, so if you don't feel immediate relief by about day 3, I mean full clearing of the symptoms, definitely please call our office back. Be great to get you in for another appointment, okay? All right, wonderful. So before you head home, just to give you a little bit more relief, I'm going to use these ear seeds. Just placed strategically on a few of the points around the outside of your ears. So all I'm going to do for these is just take these tweezers here. We'll go ahead and peel one off for you. And I'm going to stick it in just a few strategic spots that should really help encourage any draining that needs to happen. Hopefully it might bring down just a little bit of that inflammation in a more natural way, okay? So you can see they're called ear seeds. They just have a little raised black dot here. And all I'm going to do is just attach them right onto your ear here. Just going to use my finger to help me place it. Okay, good. Let's do just one more. Right up at the tip top of your ear here. So I'm just going to use my tweezers to try to pick one off. These tend to stick really, really well, but they can be a little tricky to get off of here. Okay, there we go. So same thing, this one's just going to go just a little bit higher. Just going to make sure it gets nice and attached here. Pretty well attached onto there. So you can take those off tonight when you go ahead and take your evening shower, but try to avoid getting too into that ear. We really need to at this point let it rest, okay? All right, well, thank you so much for coming in. I wish I'd met you under a little bit better circumstances, but hopefully all the treatments that we've done here are going to go a very long way in improving how comfortable your ear feels, okay? All right, well, thank you so much for coming in. Just remember, 3 days, if it hasn't completely cleared up, please give our office a call, or if at any point in those 3 days your symptoms start getting worse, going kind of downhill, then we definitely want you to call and let us know, okay? And of course, if you do start feeling better, we love to hear from our patients. Helps us know that our job is really helping people. So if you wouldn't mind calling us, if you just feel better too, we would not mind hearing from you at all, okay? We love all of our patients here, and we treat them just like family. So again, if you have any questions after this, you can always call our office, or you can email me directly if you need, okay? I'll be sure to respond as soon as possible. hopefully we won't see you here again anytime soon. But in case we do, I'll see you next time, okay? All right, bye-bye.